Good afternoon. I'm Sharon with Nurse Tim, and I'd like to welcome you to our webinar, NCLEX Across the Curriculum, Part 2, featuring Tim Bristol. We will have technical assistance available at 866-861-2896, option 3, or help@nursetim.com. Handouts are available to download on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. Our listeners are encouraged to drop us an email or give us a call. We value your feedback and also your input as to desired topics for future webinars. ANCC disclosures. Conflict of interest. This educational activities planners and the presenter have indicated they have no bias or conflict of interest. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation tool. NCPD. This workshop has been awarded 1 contact hour by Nurse Tim Incorporated. Nurse Tim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. For more information, contact help@nursetim.com. Objectives. 1. Guide the development of a lesson plan by synthesizing psychosocial integrity and psychological integrity to include basic care and pharmacology in the NCLEX test plan. 2. Utilize adult learning theory to help students incorporate the client needs in all courses across the curriculum. Purpose. This webinar will demonstrate to faculty how to effectively implement learning activities from the NCLEX test plan into every aspect of the curriculum for undergraduate, pre-licensure nursing students. Emphasis will be placed on active learning and being intentional with students to fully understand what is expected. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I'm so pleased to introduce our speaker. Tim Bristol is a faculty development and curriculum design specialist. He is an expert in bringing the evidence base of nursing, healthcare, and education to students and faculty at all levels. Through consultations, writing, and mentoring, Dr. Bristol assists faculty in identifying the competencies needed to effectively enhance programs for optimal student outcomes. He has certification as a nurse educator, is a fellow in the Academy of Nursing Education, and his motto is, "Today, we will learn how to learn." Tim's full bio is available on the nursetim.com team page. We are so thrilled to have you with us today, Tim.
Thank you, Sharon, and thank you everyone for returning to go through the next 5 client needs. But I do want to reiterate a bit of why we're doing this, why we're spending so much time focusing on this. And it has a lot to do with, we want to be evidence-based educators, right? We want to teach, we want them to learn in the same way in which they use the information, in the way they will practice, in the way they will experience education as a whole. And so as we consider the test plan, please keep in mind, it is based on solid, significant, extensive research. What does a new nurse do every day at work? What's their life like? What's their experience? What do they run into? What are their challenges? As we think about this test plan, please do take a look at it, ncsbn.org. And then what I'd like you to do is look for your test plan. If you're teaching in a PN program, if you're teaching in an RN program, take a look at the client needs. Take a look at the 8 client needs. Each of them gives tons of the of information on how does that play out for a new nurse. And so as you're thinking about your lesson plan, when are you in class with them again? When are you in lab with the students again? When are you in clinical with the students again? As you're thinking about your lesson plan for that experience, please incorporate the client needs. We learned in part one that fundamentals is hands down the most important course / set of concepts in the curriculum. We learned that the new NCLEX, the next gen, we learned in part 1 that next gen, it has a strong emphasis on fundamentals. We learned that clinical judgment, the formation of clinical judgment, discharge planning begins on admission. Our students need to start practicing with the client needs, using clinical judgment in fundamentals and doing it across the curriculum. We're going to wrap up our discussion today about this whole area of NCLEX across the curriculum by thinking about your curricular success and how do we link arms as a team to make this happen. So let's aim for the client needs. Just a reminder of the 8 client needs, and each of them has their own percentage. You go ahead and take a look at that in your test plan. You'll see the different percentages here. And as we go through the client needs, keeping in mind that even though a certain client need may have a certain percentage associated with it, guess what? It's meant to be everywhere. It really is. We can't say that psychosocial integrity is only for our mental health instructors to consider as they're building their lesson plan. No, what we find out about psychosocial integrity is that it truly does belong everywhere. I mean, if you think about it, the new nurse, very unlikely that they're going to show up working their very first job in a locked mental health unit. Very unlikely. But where abuse and neglect will show up is when they're a new nurse taking care of a patient with cellulitis and come to find out that patient has been a victim of abuse. When they're recovering a patient after an appendectomy and they find out that that patient has a significant alcohol addiction. When they're caring for a patient thinking that the treatment plan is going to look this way, this patient has a particular preference, whether it's because they're a farmer in central Minnesota or whether it's because they grew up in a refugee camp in eastern Kenya as a Somali refugee. There's a cultural diversity perspective that we have to take into consideration. There's family dynamics. All of these different things can come into play anywhere. I'm Scandinavian. I've got a lot of Norwegian blood in me, or at least that's what my grandparents tell me. I'm sure if I did 23andMe, I'd find out about a lot of other things. But anyways, how can you tell a Norwegian is an extrovert? Because when they're talking to you, instead of just looking at their shoes, they're looking at your shoes as well. That's an extrovert Norwegian. And I just have to laugh because when I got to visit Europe, Eastern Europe especially, this was so true. I mean, oh my goodness, you know, and you talk about that, those Scandinavians and how they can just be so quiet or stoic or so standoffish. Oh my goodness, it's so stereotypical of us as a culture, as a Scandinavian culture, Scandinavian background culture, whatever that means. Psychosocial integrity belongs everywhere. It really does. And med-surg instructor, community health instructor, women's health instructor, capstone critical care instructor. When you look at your NCLEX testing reports, we used to call them mountain measurement reports. But when you look at those testing reports that you get that tell you how the last few groups of students have done related to, from your program, have done on NCLEX, you're going to see many times psychosocial integrity is one of the areas your program struggles with. You're in good company. You're in good company. But here's the deal. It's not for your mental health psychiatric nurse instructor to tackle. It's for everybody to tackle. And we got to make sure that it does show up everywhere. You see, many times we struggle as nursing programs. We're like, wow, all we have in our county is a clinical dependency unit where they go in for detox for 24 to 72 hours. That's all we have in our county. Let's make sure we get every student through there. Or the students have to drive 2 hours to get to that locked mental health unit at the VA hospital 1 county over. You see, when we're talking about mental health, it oftentimes comes out to play everywhere. And when you're looking at an NCLEX, the students have to be trained that even though they're pretty sure this is a critical care question and acid base is a big deal, be looking for that mental health issue that might even be bigger, that might even be a bigger deal. Or in the words of the new NCLEX, that new clinical judgment model that National Council is rolling out. Guess what? It's called cues, recognizing cues, recognizing variances in the client that may have nothing to do with the pathology. The physiological pathology at hand has nothing to do with these variances. Show students a picture of a clinical situation. And a clinical situation, as we well know, could be my grandmother at 102 sitting in her chair watching TV at home. Take a look at a picture of a clinical situation. Each group creates a scenario. Okay, there's actually research on this. It's called reverse case study. They create a scenario where abuse could be a part of it. They swap their scenarios, they give feedback, they give comments, they talk with each other. They have to be in that create mode. National Council will sometimes at the invitational give us a quiz. What is fair and common universal language? If you can, pause the video and say whether or not each of these is fair when it comes to writing a test item. Are each of these fair when it comes to writing a test item, according to National Council State Boards of Nursing? The client is running late for an appointment. Now, one thing I like doing, getting out my Google Translate, which, by the way, my French-speaking friends, my Creole-speaking friends, they say Google Translate is probably the worst thing on the planet, but it helps me get by. It helps me when I'm at the market in Haiti and I need to buy batteries, okay? When you put in this sentence, the client is running late for an appointment, and you try to put it into like French, and then you copy what came out in French and you try to put it back in English, it's a big hot mess. It's yucky. Running late makes no sense at all if you stop for more than a half a second and think about it. Be very careful of phrases like running late. This is not fair universal language usage. The client understands Buddhist practices are peaceful. We have to be very careful with statements like this on a test item, because guess what? There may be background for this person that someone who claims to be Buddhist actually hurt them. The client is on 5 different medications. Again, this is not fair because on translates more positionally. This is more of a slang. The client has a prescription for 5 different medications. The client ate a submarine sandwich. We know that submarine is not a good universal term for this type of question. It should not be a submarine sandwich. It should be a hoagie. I'm just kidding. It is not a hoagie. It is not a submarine. What are you trying to get at when you write a test item like this? What are you trying to get at? You're usually trying to get at high carb, high fat, high sodium, low nutritional value, right? Now, my student from Nigeria, we're doing clinical in the middle of nowhere, Minnesota, okay? We're doing clinical in the middle of nowhere, Minnesota. My student has to look at the menu. What's on the menu for today? That long-term care rehab facility. Sure enough, Thursday lunch is submarine sandwich. So my student in clinical, yes, we have to think about that. and I have to teach him what is a submarine sandwich. He has to learn about that. He has to document that. He has to note that in his clinical paperwork. But when it comes to a test item that's in black and white, be careful. The alcoholic client with delirium tremens is agitated. Well, first of all, we try never to use a disease as an adjective to describe a human being. Please try not to call them an alcoholic client. It's client suffering from alcoholism. And my other question with this STEM, what else is there to test? The alcoholic client with delirium tremens is agitated. You know what? This whole STEM doesn't work for me. I would give the test taker a set of vitals, say that you're recovering this patient from an appendectomy, and they're now becoming agitated. Which question should I ask the significant other that is present? As opposed to, you've given away all the information in this one STEM. After the client sneezed, the nurse said, "Bless you." We know that is incorrect. That is not fair and common universal language. It should actually be Gesundheit. This is hilarious. I tried to do this in Haiti, in Creole, with my students, with my patients, with my nurses. They'll sneeze. I'll say, "Bon dia béni you," which means God bless you. They look at me sideways like, "What are you talking about? I just sneezed." Not a big deal. Again, my student from Nigeria in Nowhere, Minnesota, when we're doing clinical, if the patient sneezes and OSA just stands there and stares at him, not a good idea. Not a good way to build rapport with your patients. The idea here is what's common, what's fair, what translates easily. The nurse is giving report on the client. Okay, that could be considered assault. You probably should not sit on your client. The nursing unit is working shorthanded. Again, another phrase that does not translate well into other languages. So these are ideas of stems of test questions that are not fair, common, universal language. All right, now let me contradict myself now. Okay, you ready for a contradiction? When you listen to National Council talk about these new test items, these next generation test items and the next generation testing and the clinical judgment model and this whole next gen movement, you know what they say about test items? Make them real. Make them real. And the problem that we're running into right now as we're building thousands of new test items, thousands of next gen test items, the problem we're running into right now is we're trying to make it real without doing what you see here on the screen. Because you and I have both read good progress notes and we've read very poor progress notes. You and I have gotten good reports as professional nurses and we've gotten terrible reports as professional nurses. The idea here is we got to make it real, but at the same time, we've got to find ways of helping the learner get ready for action. Helping the learner get ready for what's going on in the actual clinical setting. When it comes to culture, when it comes to diversity, when it comes to all these different things that make up who a human is, how a human responds to their environment, responds to others, when you're looking at what NCLEX does in this realm, and this does fall under psychosocial. It also falls under the integrated concept of culture and spirituality. It's 10 people, 10 colors. 10 people, 10 colors. It's a Japanese proverb that basically says the minute you say something like, well, you know that Catholics will, you instantly are proven wrong. You know that people who identify this way sexually, or who are this way sexually, or who identify as this, or who are that. The minute you try to put someone in a box, you're going to run into trouble. It's on the NCLEX especially, it's 10 people, 10 colors. We need to have the learners trained when you walk into a patient's room, AKA a well-built nursing item, test item. You have to find out what's important to that individual. What's important to that individual. You can't say that because you belong to this group, whether it's related to sexuality, whether it's related to identity, whether it's related to culture, whether it's related to religion. You've got to find out what's important to that person. And we've got to press them on this. We've got to train them on this. Every student needs training in this area. And many times we make the mistake. Many times we make the mistake of saying, oh, hey, you're from Somalia, you understand diversity. Oh, hey, you're Hispanic, you understand diversity. We don't do that to your nursing students. Don't do that to your nursing students. Every one of your nursing students needs to learn what you see here on the screen. Needs to learn how to connect with people. And when we talk about connecting with people virtually, as in therapeutic texting, when we talk about connection with people in person, we have to start training them. Not everybody is the same. Not everybody's going to want the same kind of connection or interaction. The good old days of lean forward and look them in the eyes, guess what? We have people coming from so many cultures from around the globe that doesn't always work. And even if they are born, bred, raised in America, they may not like that either. This takes a lot of work. And when it comes to a test item, when it comes to NCLEX, when it comes to teaching this, we need to remember 10 people, 10 colors. And how do we do this electronically? How do we do this electronically? Our students need practice. Have them practice doing some texting. I like this activity. It's kind of a round robin. They get a blank sheet of paper. They write on it, I'm done, and they pass it to the right. And then the nurse responds. Then they pass it to the right. And then the patient responds. They pass it to the right. And they keep going back and forth. And basically what they're doing is they're learning how to text professionally. They're learning what it feels like texting professionally. How do we make that communication go? IMHO. In my humble opinion, this is a good activity. IMNERHO. In my not even remotely humble opinion, this is a great activity, right? And then for those of you, hey, MOS. What's MOS stand for? Mom over shoulder, mom over shoulder. Be careful with those acronyms, folks. You might get yourself in trouble. All right, as we did with the last set of client needs in the previous section, again, I encourage you to get with a partner, take a look at what's in the test plan, take a look at how does this play out on a day-by-day basis, and what do you need for your students to become competent in that area every class. Basic care and comfort usually has a lot to do with fundamentals, has a lot to do with what we learned in fundamentals. Again, I do tend to see lower scores in this area in many nursing programs. Why? Because we did a lot with fundamentals in semester 1, and now here we are in the final semester, right? And we left all those fundamentals behind. Fundamentals needs to show up everywhere, in every class, every semester, every lab, every semester, every clinical, every semester. A fun app for basic care and comfort, and there are many apps out there for basic care and comfort. I really encourage you to go take a look at them. But a fun app for basic care and comfort has to do with runp.com elimination. As in, you go to runp.com, and you type in whatever the movie is that you're about to watch, and the app will alert you. You hit start when you start the movie. The app will alert you when is a good time to head to the restroom. And this is very important if you're like me and like a lot of Diet Coke during that movie. Runp.com. You really got to try it out. It's pretty funny. All right. Prioritization pinup. This is a way to highlight in clinical And I use Post-it notes and stick pins. Sometimes my Post-it notes fall off the cork board. I use it in clinical a lot because it's harder to have other technologies there, but Post-it notes, stick pins, usually there's a place for that. People are safe with that. But basically, each student gets a column on the board, whether it's a cork board or a whiteboard or whatever. Don't put stick pins in the whiteboard. Okay. Anyway, each student places whatever their interventions and tasks were for the day in the order in which they were accomplished. And then they look at someone else's, okay? And they give each other feedback. They give each other feedback with these Post-it notes. They're like, hey, you could have done it this way. Hey, you could have done it that way. Because many times the activities of a new nurse, and again, our research bears this out, those practice analyses really bear this out. Many times, basic care and comfort comes up very early in the program. And what we see there is that fundamentals gets forgotten and people get confused on what is a priority and get confused on what is important to the patient. Have them work with each other to reorganize these Post-it notes and going, what could I have done? I like this activity in post-conference because many times in post-conference, after a long day of clinical, students are tired. It's usually hot in the post-conference room. They're just trying to stay awake just to last one more hour. This gets them up out of their chair. They're working with color. They're moving their hands around, their Post-it notes around. It's a way to keep them going. I quit taking my Lasix because I kept peeing all over myself. Not very conducive to a good sex life. This is a quote from a veteran that we were trying to get to stay on his diuretics because of his heart failure. He just wasn't having it. I had to leave my village because after I was raped, I leaked urine. I just want to not leak urine so someone will want me again. This is a quote from a woman in the surgical area that I'd taken a group of students to DR Congo. And we were working in the surgical area with women who were victims of the rebels and the guerrilla warriors that were running through villages, just pillaging. When you talk about a nurse's priority concern, does it line up with the client? Does it line up with the client? Many times we miss the mark on basic care and comfort because we're so worried on electricity. We're worried about electricity and drugs. You know exactly what I'm talking about. That we miss the client's priority. And I have a feeling as we're moving, because remember what I said in part one, as we're looking at the next generation questions, as we're studying what National Council is putting out, how they're handling these next generation questions, guess what? It's fuzziness like this. It's cues. National Council in their new clinical judgment model actually calls what you see on the screen right here. These two bullets are cues that the nurse must take into consideration and adjust accordingly. These are actual cues. So as we're looking at the new NCLEX, folks, I think we're going to have to do more, and rightfully so. This is reality. These are real quotes from real human beings that had a real impact on the lesson plan, on the plan of care, on the nursing care plan. Oh, that's right. Tim just made a angels in heaven, whatever sound that was. The idea here is these things matter tremendously, and these things can trump those other areas that we hold so high, that we hold in high esteem. All right, so create a learning activity. Go into the test plan, LPN or RN. Go into the test plan. Find that basic care and comfort area and try to create a learning activity for the next time you're with students. And please don't shy away from this. If you're in critical care, if you're in mental health, no matter where you are, please try this out. Try to get a buddy involved and have the students seeing this coming from multiple environments. All right, pharmacological, and this is one of the parts of physiological integrity. Basically, students, you'll hear students complain, oh my goodness, the exam was all pharm. Or, oh my goodness, when I took NCLEX, it was all pharm. And I would be willing to bet that a majority of the time, it's about safety as opposed to pharm. I remember it was about 10 years ago, we had a huge bump, listen to me, I think it was 2%. I don't remember. There was a bump in pharm. Pharm was required, and NCLEX pass rates plummeted, and there was mass chaos, and everybody changed their curriculum, and then it switched more to management of care. And that's because I believe that the focus is more on safety. It's not what a student knows, it's how they learn, how they continue to learn, how they continue to investigate and know. I'm always asking students for a top 3, a top 5. And I want them to create the top 3. I want them to create the top 5, because when they create it, they own it. When it comes to a medication, what are the top 5 things you really have to know about this medication? As a nurse is caring for a patient using this medication, what are the top 5 things? And whether you use the 5 rights of safe medication administration, the 6 rights, the 7 rights, the 8 rights, guess what? It doesn't matter. Safety, it has got to be everywhere. No matter how good you are at clinical calculations, safety has got to be anywhere. One of my favorite Nurse Think questions has to do with doing a clinical calculation. Built out an EHR, an electronic health record for the question, put all this information in the question. In the case, safety has to be everywhere. And the thing that's interesting is the answer to the math problem is 0, because the patient in the EHR is allergic to the medication. And the only way you'll find that is if you really pay close attention to every aspect of the EHR. So even though you're really good at dimensional analysis, you're really good at clinical calculations because of safety, the answer to the math problem is 0. It's simple, no calculator required. But please remember, it's not fair to test this way if you don't teach this way. Not fair to test this way if you don't teach this way. If you're going to have safety, see, your students are going to say, oh, that was a trick question. That was a trick. If your students are going to say, oh, that was a trick question, then what that means is you haven't been teaching that way. Students need to learn where they think they've got it figured out because they memorized that lisinopril is an ACE inhibitor. They're ready to be a nurse now. They need to experience, if you will, this very issue where safety trumps all. Students, choose a system. For that system as a group, I'm putting you into small groups or dyads. What are the top 5 meds for that system that a new nurse should know? If you're in a concept-based curriculum, what are the top 5 meds for that concept that a new nurse should need to know? For each of those top 5, come up with the top 5 nursing concerns. See, this activity, because they want to know the answers to this. They want to know the right answer to what you see on the screen here. So the idea here is this activity helps them start to learn in the same way in which they will use the information, because no nurse can memorize every single possible med out there. And this is why National Council with NextGen is going to start adding to some questions a page out of the drug guide, These lists, they have to create them themselves. When teaching MedPass, is it done in a realistic fashion, as in chaos? Because chaos isn't just the reality of most nurses It's actually layer 4 of the clinical judgment measurement model that is guiding the development of the next generation of NCLEX. Okay, that chaos. That layer 4, it's called the context layer. Nurses function in chaos. This is an activity that kind of highlights that chaos. The students get a blank sheet of paper. Each of them get a blank sheet of paper. They write a medication in the middle of the sheet of paper. Bullet, target, middle. Aspirin, methotrexate, lisinopril. You fill in the blank. On that sheet of paper, they start a basic concept map of branching out what assessments and intervention might be applicable for a client that's using that medication. As they start to build their concept map, the music starts. I like more upbeat, more instrumental, kind of a heavier electronic dance type music that's kind of it's kind of in your space, if you know what I mean. And the whole time they're concept mapping, I give them about 60 seconds. This music is playing a little bit louder than is comfortable. The music stops. They hand their concept map to the right. They move their concept map to the right. They start building off of the concept map that they were just handed. The music goes back on, their concept mapping, they keep going. It's called a farm map relay. Nurses in practice experience over 6.3 work interruptions per hour when passing meds. How does this learning activity resemble real life? I got some loud music playing. You're trying to concept map related to this medication. The music stops. You hand the map off to someone else. You get a new map. You keep going. You see, they're learning in context, how vital that is. They keep passing. They keep passing until we're done. Then they pass the maps back to the left. You get your map back. You see what kind of, how was that situation managed when multiple people had to get involved? How did your colleagues interpret you doing this? I like doing this in class. We get 50, 60 students, or I'll do it in a conference and we'll have 200, 300, 400 people sitting in a conference. We'll do this. I love doing this activity because we ask questions like, how many of you got out your drug guide? 2 or 3 hands will pop up. How many of you saw a medication that you weren't exactly comfortable with? A few more hands go up. You see, this kind of activity highlights that it's not just about memorizing that lisinopril is an ACE inhibitor. It goes way beyond that. Pharmacy techs, PCAs, med techs that have had an 8-week CNA course plus a 4-week MedPass course know that lisinopril is an ACE inhibitor. They actually know that fact. Yet they're definitely not ready to be a nurse. You see, this allows us to build context into the mix. Again, that integrated concept of culture. That integrated concept of culture. We have to acknowledge these concerns by the clients. Students have to be challenged with this sort of thing. Even if your pharmacology course is a pre-nursing course, and in many curriculum it is, you take pharmacology before you even start your Foundations of Nursing course. These sorts of things need to come up in that pharmacology course. All right. As we're moving right along here, do give this a shot. Try to make it a part of what's going on there. All right. Physiological integrity. There's actually, reduction of risk potential, which is part of physiological integrity. There's actually a list of labs in this section of the test plan. You're going to see that list there. And as with any list that National Council gives you, this is only a sample list. That there's others right? One thing that's important to understand with labs and diagnostics, can they identify and or prioritize through change? Through change. And National Council has given us some examples of change and or changes in labs and or you've got a bunch of labs that are not exactly spot on, a bunch of highs and a bunch of lows. And the student has to pick the most important one. You see, when we go to clinical and we show students a lab report and there's like 4 H's and 7 L's, highs and lows, on that clinical lab report, they're going to write down all of them, aren't they? They're going to write down every single H, every single L. Some of them go as far as writing down every single lab. There's no prioritization involved. And as a new nurse, you absolutely have got to prioritize. You absolutely have got to prioritize as a new nurse. You've got to find those changes. You've got to look at what are the priority H's and the priority L's, because you and I both know as professionals, a majority of the H's and L's are not the priority. Can you determine what complications might be around the corner? Can you argue for a change in therapy? Can you create a change in the care plan based on all this information you're pulling together here? Developing students' clinical imagination helps them recognize changes. And this is actually a book called Educating Nurses. Lisa Day said this. You might know that the primary author on this work is Patricia Benner. Students have got to practice this. They've got to use their imagination. When you watch the video, the Next Generation NCLEX video that Karen Sherrill puts out on the Nurse Tim website, it's one of the webinars. Go take a look at it. Karen teaches you how to get your students into this brainstorming mindset. Students have got to brainstorm. Students have got to use their imagination. And interestingly enough, 2010 in this book, this phrase clinical imagination shows up over 50 times. And now as we sit over a decade later, we're now seeing it show up in ProQuest and CENOL. It's being researched. And the way that Lisa Day and Patricia Benner conceptualize clinical imagination is it's the bridge between critical thinking and clinical judgment. It's a bridge. Your students need to be able to make an argument for a change in therapy. Your students need to be able to do this in class, every day of class. They need to be able to do it in clinical. They need to be able to do it in lab. The rehabilitation nurse discovers a pressure ulcer, stage 2, 61-year-old male, history of SCI and quadriplegia. As a team, develop a concept map, cause and effect. Cause and effect. I like using poster boards with Post-it notes. I like using Post-it notes for my concept maps because the minute I draw on a piece of paper, I want to move whatever I drew. And that's just me. So Karen Sherrill and I, we do a lot of Post-it notes with our concept maps. And these Post-it notes, you write on them and you can start to move them around before you actually start drawing the lines to connect the concepts, to connect the issues, connecting the different parts of the discussion. Cause and effect is a great way to go. I like using 2 colors as opposed to 4, 5, 6, 7 colors. I like using 2 colors at a time as a way of helping the learner start to really make connections there. In this particular example, I might use yellow or gold for cause, and I might use purple or blue for effect. I get everything kind of lined up. We have a little bit of discussion, then I start drawing the lines. After we've gone through phase 1 of the concept mapping, then we pass our map to another team based on what they see on this concept map. The new team, the team that receives the map, They start to come up with processes to prevent future events. And you can have yet a third team evaluate the new processes. Reduction of risk potential has a lot of fun little pearls and nuggets in it. I encourage you to sneak in there as this kitty's experiencing here, get a taste. It's a fun client need. Listen to me, I'm such a geek. I mean, my goodness, who says fun about the NCLEX test plan, client need tests? Anyway, there's some fun things happening in reduction of risk potential. I do encourage you to go take a look. All right. Physiological adaptation is the last client need here. It's the last client need, and basically here you have actual diseases. Some disease processes are called out. You have certain procedures that might be found in here as well. Not all of them. Not all of them. Some are in other parts of the test plan. You see a lot of signs and symptoms. You see a lot of discussion of acute and chronic, different parts and pieces like that. You're going to see wound care, disease-specific discussions, lots of moving parts here. And it is a bit heavier when it comes to percentages, when you look at percentages. So this is where we start to connect a lot of the different parts and pieces to the care plan. A lot of the different pathophysiology, A&P tied to the care plan. And you got to make that connection. But when we talk about care planning, I want you to be cautious. How does a nurse, if you followed around, like let's say 100 brand new nurses for 8 hours each, how would they be care planning? Would they be sitting at a computer typing for 4 hours into that 8-page care plan? No. They would be doing what Dr. Herman describes as the 1-minute care plan. On the go, on the fly, constantly having to make adjustments, and putting together a care plan that you literally can build in 1 to 5 minutes. I do encourage faculty to take a look at their current care planning form, their current care pathway form, their current concept map form. Can you turn it into a 1 to 5 minute activity? Give it a shot. Create that 1 to 5 minute activity, that 1 to 5 minute short form, quick form, whatever you want to call it, and then have them try it out. Watch a YouTube video on a patient. Have the students watch that video and then try out the 1 to 5 minute care plan. Because this is what the new nurse does. On a moment by moment basis, he or she is having to move in and out of that care planning environment. I love having students create test items. When they're creating test items, they really are thinking at a high level. Maybe they come up with a couple of questions on note cards related to the patient they've been caring for today in clinical. During the last half of clinical, they hand out, the instructor collects up during the first half of clinical questions related to patients, then they randomly hand them out to other students. And during post-conference, they discuss the cards, the questions that were created. This really makes the pathophysiology real when you do activities like this in clinical. And it's a very simple one. It's a very student-centered activity. If anything, the instructor just has to facilitate it. Having students look at the patient they cared for today. What would be a cultural consideration that might interrupt or affect or change or send the care plan in a different way? Students discuss that with a peer. Very powerful way to learn. Oh, here's the test question. Here's the test question I was telling you about. And you can actually go look at this EHR. And this is important because what we're seeing with National Council, pretty much, I'd say easily over 80% of their next generation, their new question types involve an EHR of some type. This is a simple question where it used to just be a math problem, but we pulled some of the information out of the math problem, create a test item, create a real set of orders, not just the order related to the item at hand that we want you to do math on. There's information on the drug from the drug guide, just like they're doing on the new NCLEX. We pull out the patient's weight, and students dive in thinking they can do math when they find out the patient's actually allergic to this medication. So the answer to the math problem is 0. You see, this is the way we need to teach. This is the learning experiences that need to happen. Because it's learning experiences like this that are going to address the fact that 50% of people passing NCLEX are involved in a medical error. Address the fact that only 11% of people in 2019, 11% of new nurses were practice ready in 2019. It's this kind of learning activity that's going to help move that needle. So physiological adaptation, there you have it. There's our 8 client needs. Now, curricular success, we're just going to wrap up here real quick. Look for themes that you can do across the curriculum, okay? Look for ideas that you can move across the curriculum. And when you look at the NCLEX test plan, the client needs serve as an excellent way to thread realism, thread clinical judgment across the curriculum. Keep that test plan nearby. Commit to at least one client need in every class that you teach, every lab that you teach, every clinical post-conference that you manage. Come up with a clinical reasoning, a clinical judgment process that can be used by all students or faculty. And this can be everything from having a client need card in every class to you fill in the blank. When we talk about blueprinting test items, also consider blueprinting learning activities to the test plan. We've got to be intentional here. When it comes to NCLEX prep, there's a lot of fantastic tools, such as that tutorial that I pointed you towards in part 1, where you go into the FAQs and you look at alternate format test items on National Council's website, ncsbn.org. Students, they need to do 20 clinical judgment questions a couple times a week through the entire program, because students have to know what they don't know. Students need to take those standardized testing reports, the Kaplan, the HESI, the NurseThink, the ATI. They need to take those standardized testing reports to clinical. Well, Tim, they used it in the finals. How could they take it to clinical? Next semester, they take that report to clinical. And then students need to get carded in clinical. As in, they've got a note card created for each of the client needs, and during clinical, another student randomly picks one of their cards and uses it as a way of discussing their client care at a very high level. If you go to YouTube and you search for NurseThink carded, you're going to find a YouTube video that I created on this concept of getting carded in clinical. All right, so now we've moved through all 8 of the client needs. We have moved through a little bit on next gen and the clinical judgment model. Again, I do encourage you to go to ncsbn.org, ncsbn.org, and type in the search window, NGN. Type in the search window, NGN. I do hope that you will take a look at the sample questions under NGN resources. They're usually found in the newsletter, in the newsletters. I believe it was spring and summer of 2020. And you're gonna see there those different sample questions. Now, as you look at those sample questions, please resist the urge to try first writing sample test items for your next exam. Please don't do that. You need a couple of months, yes, I said months, of trying to teach with those sample test items as learning activities. Teach with those sample test items as learning activities before you start testing with them. And when you look at those next generation test items, they are so powerful, you're going to find amazing learning activities. I do hope that you'll contact us if you have any questions at all, help@nursethink.com. Let us know what your questions are related to this. If you have ideas related to this, we'd love to hear those as well. Thank you for spending some time with us. Please do fill out the evaluation. You'll find the link on the side of the screen here. Do fill out the evaluation in order to access your nursing contact hours. That's really important, and we really covet your feedback. We're always looking at feedback, finding ways of making these webinars better. I am Nurse Tim, and I appreciate you taking your time today to address this really important issue. NCLEX across the curriculum, parts 1 and 2. I do encourage you to continue your study. Do take a look at our other webinars related to NCSBN or NCLEX. You're going to find a lot of great material there. Thank you for joining me. I hope you'll make it a great day. Bye for now.